Hi, everyone. This is Debra Shushan. I am the Director of Government Affairs at J Street. Happy to welcome all of you today for what is a really important program. Sorry that it took us a couple of extra minutes to get started, but we had some technical difficulties with folks joining us from far away, who I will introduce in a moment. Our webinar today is on the situation for Palestinian refugees in the West Bank, East Jerusalem, and the Gaza Strip during the COVID-19 outbreak. And we're really delighted to have the best possible panel of guests here today to talk with us. I'll introduce them now and then frame the webinar just a little bit. The three guests that we have with us today are Gwyn Lewis, who is joining us from Jerusalem. She is the Director of UNRWA Operations in the West Bank, and she leads all programmatic and operational components of UNRWA operations throughout the West Bank. Before she was assigned to Jerusalem, she was the Deputy Director of Programs for UNRWA in Lebanon. We also have with us Matthias, Dr. Matthias Schmale, who is joining us from Gaza City, where he has been under lockdown together with the rest of the population of the Gaza Strip during the duration of the COVID-19 crisis. He's the Director of UNRWA Operations in the Gaza Strip, and prior to joining UNRWA, he held the posts of Undersecretary General with the International Red Cross and Red Crescent Societies. And then joining us from Washington, D.C., we have Dr. Elizabeth Campbell, who is the Director of UNRWA's Representative Office in Washington. Prior to joining UNRWA, Dr. Campbell was the Senior Humanitarian Policy Officer in the Bureau of International Organization Affairs at the State Department, where she worked on refugee and humanitarian issues in the UN system. Thank you so much to all of our esteemed guests for joining us today. So we're going to be talking about the situation for Palestinians in the occupied territories during the COVID-19 crisis. And I'm also looking forward to taking a bit of an opportunity to talk about UNRWA more broadly, what it does, and some of the misconceptions that are out there about UNRWA, many of which have been spoken vociferously by the Trump administration over the last few years. So we'll get started today. We are going to have updates from the field from Gwyn and Matthias. I'll have a few questions for our panelists, and then we'll have the opportunity for our audience to ask questions. So I'll just invite everyone right now to look at the bottom of your Zoom screens, and you'll see Q&A. At any time, please feel free to click on Q&A and to type in your preferably short question for our panelists. So thanks so much, everyone. And Gwyn, I'm going to start with you. Can you share with us a bit of an update of the situation for Palestinian refugees on the ground in the West Bank and East Jerusalem?
Thank you, Debra. I'm very happy to be here, and apologies for the delay. It was my fault. Maybe just to start by going back a little bit, we've had a few cases of corona, and now it's close to 520 or so cases of corona and COVID-19 in the West Bank, and the first cases started in March. And since then, we've seen quite a few restrictions on movement. But first, maybe to just describe very briefly on our operations and what we're doing, and then what we've done in response to the virus and some of the challenges that we still have remaining. So we have in the West Bank over 90 schools, 42 health centers that we manage, as well as sanitation in the 19 camps that are in the West Bank. And we do infrastructure work, we do some microfinance programs, and we also do some social work. And so when the first cases of the virus were announced in March, like the Palestinian Authority, we closed down most of our schools. And we did that in order to restrict movement and also protect the children, obviously. But we also turned our 42 health centers into triage centers in order to help the Ministry of Health and the Palestinian Authority manage the crisis. And so we've continued to do that throughout the last couple of months. And we've also tailored our social support and our social protection programs so that they're remote. So most of our social workers now work from home. We have hotlines in place, and we do proactive calling of more vulnerable families and outreach, because like in many places, there's a lot of concern about protection issues at home and increased violence in the home. And so we're doing a lot of work in that regard as well. And all of our sanitation work has continued. We're cleaning the camps, making sure garbage is collected on a timely basis. So we've really done a lot of work to strengthen our operation to help with the COVID response. That has been pretty effective. And with 520 cases or so in the West Bank, including East Jerusalem, it just goes to show that the movement restrictions and the measures that were put in place by the Palestinian Authority and that we supported really have restricted the spread of the virus. But one of the big challenges that still remain is around a couple of areas. The first is in East Jerusalem. We provide services also in East Jerusalem. But because of the lack of service provision in some of the areas by the municipality of East Jerusalem and the lack of access of the Palestinian Authority to those areas, it has meant that we haven't had the same levels of testing or health support or the same measures to restrict movement in those areas. So we've seen less services, and we're seeing a continued increase in cases in East Jerusalem. So that is one area that we're concerned about. We have seen some steps since the middle of April, when the Israeli Supreme Court ordered health testing to be established in East Jerusalem. And so we're seeing better coordination and collaboration, but there's still some work to be done there. The other big concern is many Palestinians are working in Israel, and there's a very significant number of people traveling back and forth. It's about 110,000 workers working in settlements inside the West Bank or working in Israel. And so there's very little coordination and control of the flow of movement between Israel and the West Bank. So the majority of new COVID cases that we have in the West Bank are Palestinian workers coming back from Israel. So coordination around that is really needed, particularly now as we come up to the end of the holy month of Ramadan, when we begin to see the Eid holidays. What we'll see is an increase in workers, and we're concerned about an additional outbreak. And I'll just raise one more point that I think is relevant to the discussion today, is that despite some improved collaboration and coordination between the Israelis and the Palestinian authorities around the crisis, the occupation and what it means for Palestinians hasn't abated. Just in the last week, we've seen about 90 Israeli security force incursions into the West Bank. And that means use of tear gas and live ammunition and sand bombs. And we had one incident today in Kalandia camp, which is one of the camps that is in East Jerusalem, where the tear gas was so intense around our health center, we had to close it down and evacuate all of our staff and the patients in the health center, because the Israeli security forces had entered the camp. We're trying to restrict movement, but the measures that they take are so heavy-handed that it resulted in some staff inhaling tear gas. We've had continued child detention, arrest of children. And what we've also seen in the last couple of months is an upsurge in settler violence in the West Bank, because there's less movement and an inability to damage trees, move into land, take over land. So that's also something that we've seen over the last months. So the protection concerns and some of the ongoing concerns because of the occupation are continuing. So maybe I'll stop there.
Thank you so much, Gwyn. Appreciate that update very much. Matthias, I'd like to turn it over to you and get your update from Gaza.
Thank you, Debra, and good afternoon, good morning, everyone. Just in relation to your reference that we've been in lockdown here, it reminded me that many Gaza activists and others, when this started in early March, were sort of spreading the message of welcoming the world to the experience of living in quarantine. Because as far as many Palestinians are concerned, Gaza has been in lockdown for 14 years as a result of the blockade. So in that sense, you know, the experience of not being able to move is not particularly new for many people here, and in those terms they seem to have coped. The good news so far is that the virus has not broken out locally. We have 17 confirmed positive cases, but they're all in quarantine areas. And we attribute that in part to fairly quick measures also here by the local authorities after it reached the region in early March. They then fairly quickly required everyone coming in to go into quarantine centers. We led the way, just as in the West Bank, closing our schools. We run 276 schools here, populated by 282,000 children. So there's 2 million people in Gaza, about 1.4 million of them refugees. So more than 10% of the population in Gaza goes into our schools, and taking them out of schools and having them stay at home together with the almost 9,000 education staff and so on, we think was a key measure in containment. So far we've been lucky there. We did similar things as Gwyn described for the West Bank. Because we are such a big player here, it has impact. We have 22 health centers that provide 1 million primary healthcare consultations every quarter. So it's massively important in terms of keeping the population healthy, which is of course even more important when we're trying to fight a pandemic. You may have heard also, we not only provide our basic government-like services, the schools and the health centers, we also have a massive humanitarian action program here, the key component of which is providing food to 1.1 million people every quarter. So more than 50% of the population depends on food from UNRWA. We temporarily suspended that after the first 2 cases became known, because we, of course, were worried that with hundreds of people at our distribution centers every day, that would be extremely risky for the spread of the virus if it were here. We then found a way of safer delivery to homes of people, which is much more complex, but it seems to be working. Now, as long as we are, let me say something else first. We are, of course, very worried and remain very worried about a local outbreak, meaning if the virus were to be transmitted from the quarantine installations into the local communities. And the reason for that is that after almost 15 years of blockade, 14 years of blockade, the health sector here, the public health sector, is completely in meltdown. We saw this also through the period of the Great March of Return over the past 2 years. When things got really rough, they were unable to cope. To make this a bit more concrete, World Health Organization experts say that for every 100 people who get ill or who get positive with the virus, 5 will need an ICU bed, an intensive care unit bed. There's a total of 87 in Gaza, so you can do the mathematics. As soon as there's 1,500 to 2,000 people ill or positive, let's say with symptoms, the hospitals would fall apart. They would not be able to cope. So we really have to hope for the best that it stays this way. At the moment, the issue is a little bit fighting complacency, because of course, after 2 months of staying at home, of restaurants closed, of mosques closed in the middle of Ramadan, people are getting restless, like everywhere in the world, and are beginning to say, well, obviously the virus has not touched us here. So let's ease up. So we really, one of the things I continuously preach is to say, let's not celebrate too early, because again, it would be devastating if we're not able collectively to contain the virus in quarantine installations. This makes behavior very important. So it's not just about services, it's also about trying to influence behavior. And through the 282,000 children and their parents, we have quite a reach into Gaza. Our chief of education likes to say that we basically have an ambassador in almost every household. And that matters right now, because if we are to be successful in further containing it, or if there is an outbreak, what will be critical, a local outbreak will be critical then to keep numbers of people dying as low as possible, will be behavior about physical distancing and hand washing as much as that's possible, etc. So we are also playing a massive role, like no one else, I think, in the Gaza Strip, in terms of trying to influence people to be ready for the worst, also in behavioral terms, and knowing what to do in the very difficult circumstances here. Two more points, if I may. One is what we're beginning to see, I think Gwyn made a reference to that also for the West Bank, is that whether the virus breaks out locally or not, there will be socioeconomic impact. We had 50% unemployment before Corona came, and the economists are predicting it will rise to 70%, whether there's an outbreak or not. So like everyone, including in the US, we will see massive socioeconomic impact, which of course will hit Gaza very hard in any case. So we're really starting to think through with many others, how can we be ready for that and support people in coping. And then final point is, I sometimes hear a discussion around, well, back to my opening comment, is the blockade actually a good thing because it's protected Gaza in this case? And what is correct factually is that it became a pandemic, Corona, because of travel and movement. So restricted travel was to the benefit of Gaza. Having said that, though, the fact that the health sector is falling apart is due to the blockade, and we are not through this yet. If there is an outbreak, it will be precisely the blockade that will be the trigger for the background for a major catastrophe. So we need to stay, as Gwyn also implied for the West Bank, very realistic about the political dynamics that have not fundamentally changed. Thank you.
Thank you so much, Matthias. We appreciate that update very much from Gaza City. So what I'd like to do now is just to remind our audience that you'll be able to ask questions in just a little bit. The way to do that is to go to the Q&A at the bottom of your Zoom screen and just type in a question there. Before we do that, though, I'd like to ask some questions of our panelists, and I'm going to start with Elizabeth, UNRWA's Washington, D.C. director. Elizabeth, I'd like for you to kind of set the context a little bit for UNRWA's work for us. And I'd like you to talk a little bit, especially about UNRWA's financial situation. We know that going back to 2018, that the Trump administration cut all funding to UNRWA. We know that the Trump administration, beyond just doing that, has also embarked on a campaign against UNRWA in order to get other countries to defund UNRWA as well. I just want to share with our listeners a couple of things, and I'd love to get Elizabeth to respond to these. We have a letter from Jared Kushner, who of course has been, as President Trump's son-in-law, in charge of the so-called Trump peace plan. He's been extremely critical of UNRWA. He sent an internal letter, a confidential letter within the Trump administration to some colleagues saying in 2018, January of 2018, it's very important to have an honest and sincere effort to disrupt UNRWA, which, he said, perpetuates a status quo, is corrupt, inefficient, and doesn't help peace. Our goal can't be to help things stable as they are. Our goal had to be to make things significantly better. Sometimes you have to strategically risk breaking things in order to get there. And apparently UNRWA is one of those things that the Kushner plan would like to strategically break. We have Jason Greenblatt, who was for a long time the Trump administration's envoy for the peace process, if you will, who effectively called for dismantling UNRWA, calling it a Band-Aid that was running on fumes, whose services should be taken over by host countries or NGOs. He criticized UNRWA's quote-unquote business model and pushed for against a renewal of UNRWA's mandate by the UN in favor of a more sustainable solution, which he advocated could be in the form of host countries providing services to Palestinian refugees. So, Elizabeth, I'm sure that you are very well familiar with all of these critiques of UNRWA. I wonder if you could respond to some of these critiques by the Trump administration, the allegations of corruption, of fundamentally being broken, and of there being a better solution out there for Palestinian refugees.
All right, thank you so much, Debra. I will try to be brief because I'm sure the folks online would be keen to ask questions. But the first point I want to say very clearly is that everyone who works in UNRWA is deeply proud of the US UNRWA partnership that lasted for almost 7 decades. You know, I often hear my colleagues say, and Matthias in particular, that the human capacity, the institutional capacity that the organization has today to respond to yet another crisis is largely a result of sustained American investment over time in our health and education and humanitarian response systems. And if we hadn't had that at this moment, I think we would all be flailing and struggling in ways that we see in other parts of the world. So that's just the first point I want to make, and that we, of course, you know, lament and feel saddened when the US walked away, and it was a huge partner for us and something that we continue to miss today. So what has happened as a result, we are now moving into the 3rd year of no US funding, which historically constituted about 30% of our budget, is that it has had a corrosive impact on our institutions. So every year, bit by bit, we sort of shave off more of our effectiveness and our ability to help this very vulnerable population. And the challenge for us is that despite wishful thinking that there is a magic wand or a magic solution or another way to go about providing these services, there simply is not. There is not another UN organization who has the capacity and abilities to directly provide services. Most of those organizations are contracting with other groups at much, much higher costs. So even if, for example, another UN agency were to take over, you're looking at, you know, doubling or tripling the total costs required to provide the same services, but they don't have the capacity that we have. Secondly, you know, it is sheer wishful thinking that any non-governmental organization, despite their competencies, would ever be able to absorb the scale and scope of our work. And just to sort of put this in perspective, you know, we are not talking about small projects dotted across the Middle East. We are talking about a school system that services over 500,000 children. If you put that into the United States, it would be the 3rd largest after New York and Los Angeles. I don't think there is a single NGO that could stand up and be able to simply implement a program of that size. So for us, there is no alternative. No government in the region or otherwise has agreed to take over responsibilities. And so we have been mandated, and our mandate was overwhelmingly approved in the UN General Assembly late last year to continue to do these services until there is a political solution. So what has failed is reaching a just and lasting solution. The political actors responsible for that. What we do is simply manage these services to the best of our ability amidst, you know, sort of chronic conflict, if you will, to do the best thing that we can for one of the most vulnerable populations across the Middle East.
Great, thank you so much, Elizabeth. I wonder if you could talk a little bit about UNRWA's financial situation. Specifically, could you put in context for us the amount of money that the U.S. has historically contributed to UNRWA, how that's changed under the Trump administration, what congressional appropriations have looked like over that period? I apologize for throwing a lot of financial questions at you all at once, but also to what extent the international community has stepped in to cover the deficit that has resulted from the cutting of funds by the United States?
Sure. So the most important thing to know is that the United States remains the world's largest humanitarian donor. So everywhere in the world where there is a humanitarian crisis, the United States is, in most cases, not all, but most cases, the largest, if not one of the largest humanitarian donors. So anytime the US pulls out everything the way that they did with us, which by the way was completely unprecedented, you feel the immediate impact. And this idea that there are comparable donors that fill the gap is misleading and wrong. Of course, there are other global donors that are generous. And here, of course, we have the EU, we have Germany, the UK, Sweden, many, many others, Japan, Canada. These are all donors of UNRWA. But they don't have the total amount of resources available, which means that though they have stepped in and stepped up to try to cover the $360 million that we lost from the United States, they cannot easily fill that gap. And that is why, despite their best efforts and the increase in partnership and commitment that they have to the institution, it's largely just not enough. I mean, it's very difficult for us to operate without the US. And I think just going back to some of the original comments you made, it's not just that the US walked away from the table, but then they also engaged in a series of myths or falsehoods about the agency. And I do believe that that has had an impact of sort of, if you will, scaring other donors away, right? That it's sort of it's not worth the risk to invest in these institutions, these human development and humanitarian institutions. So that we've seen a knock-on effect that has negatively increased our ability to fundraise. So as I said, we found a way to keep the programs going, but barely. Today, we operate on a month-by-month basis. So each month, we get a financial update that we've sort of scrapped together enough money from various different sources to pay the bills for that month. And clearly, that is not a way to run an organization of our size and of our scope.
Okay, great, or not great, but thank you very much for that. Let me just remind our audience, because I'm going to be getting to Q&A from the audience in just a little bit. So please do feel free to add your questions to the Q&A at the bottom of the screen. There's one myth, let's say, in particular that I'd love to give actually all of our panelists, any of our panelists who'd like to jump in, the opportunity to respond to. And it's one of the things that we have heard from the Trump administration, which is that UNRWA perpetuates the Palestinian refugee problem. And somehow if there wasn't an UNRWA, let's say if services for Palestinian refugees were provided through the UNHCR, which is the UN body that helps refugees in the rest of the world, then the political question of the Palestinian refugee problem would go away. I'd love to hear any of you react to that.
I guess I can start. It's a complete falsehood. As I said, we don't perpetuate anything but education, healthcare, and humanitarian assistance. We're not a political actor, we're a humanitarian actor, and we have not been charged with the authority to try to bring a political resolution to the conflict that would also end or find a just and lasting solution for the refugee question. Just one comment on UNHCR, and I'll let my colleagues weigh in. I never really understand why critics point to UNHCR as the solution for UNRWA. In UNHCR's, it has a convention law underpinning its mandate, but it basically is charged with finding solutions for refugees. There's 3 solutions, and its preferred solution that it promotes globally for every refugee population on the planet is the right of return. This is where it invests its resources, its political capital, and where it also sees the possibility for just and lasting solutions. I think sometimes folks incorrectly believe that if UNHCR somehow had responsibility for Palestine refugees, that they would all sort of magically be resettled to third countries. Less than 0.5% of the total refugee population globally has access to third country resettlement. It's simply not a tool that's available to the majority.
Matthias, I see you want to weigh in as well.
Yeah, well, the 2 comments perhaps I would add is number one, and I'm speaking of course in the Gaza context, but I think Gwyn and other colleagues would be able to say the same thing. We are in Gaza exposing 282,000 children at the moment to an international standards education, where they are exposed to international standards and norms, including human rights values. And anyone has to explain to me how that can be a bad thing and perpetuating a problem when you actually try to influence at the moment 282,000 children very positively to, let's say, a global education. One of our previous Commissioner Generals used to say we are making the children some sort of global citizen, because we are teaching the host country curriculum, but in addition to that, We're trying to instill in them a sense of global citizenship. So I cannot understand how that can be seen as a problem. The second comment is 90%, if not more, of our staff are Palestinians. It's the investment that was spoken about earlier also from the US that Elizabeth mentions is an investment into local capacity. You know, so if there was a Palestinian state, you would have, in the case of Gaza, more than 8,000 teachers ready to run the education system of a Palestinian state. So it's in fact an investment into the future. What is missing in the equation is not good education or good health. That's not the problem. The problem is the political solution is absent. You know, the promise that Palestinians were given 70 years ago that they would get a state of their own, hence all the talk about a two-state solution and so on, that has not been fulfilled. And you know, even if you shut down UNRWA, you will not eliminate that particular question. That has to be answered whether UNRWA exists or not.
Okay, thank you so much to our panelists for that. We do have a number of questions that have been submitted on the Q&A. Thank you very much for that. Just to remind folks that they can go to the Q&A at the bottom of their screens and pose some questions. So I'm going to take some of those questions and pose them to our audience. There are a number of questions that are directed at Matthias because they are on Gaza. So let me take a couple of those at once. So Matthias, from Ferry Cress, we have the question, what is your budget for your work in Gaza? And how many UN employees are currently working in the Gaza Strip? And then we have a question from Kyle Christophalo of Churches for Middle East Peace. And he asks, should things shift and Gaza does begin to experience a more widespread COVID outbreak, would it even be possible to get in more ICU beds or other medical equipment given the blockade?
So fairly straightforward questions on the budget. The overall budget for UNRWA across its 5 fields and across different funding portals is 1.4 billion. That covers our core services like education and health, and it covers humanitarian action like the food program. The Gaza specific component in this, but you know, it's one budget, is roughly $220 million for the core services, education and so on, and about 120 million for humanitarian action. So you're looking at a budget of 350 to 400 million. That's the part of the overall budget that we need for Gaza. But again, it's centrally managed. We don't have our own budget and our own income. We are the biggest field in Gaza. In terms of employees, overall, UNRWA has 30,000. Of those, roughly 13,000 are in Gaza. I mentioned, I think earlier, almost 9,000 of those are the ones running 276 schools. Another 1,000 are running the health centers, are the health teams. Now the question of if there was a local outbreak, would we get in materials like ICU beds? The first thing I'd have to say on that is the time is now to do that, and we're trying the best we can. I have to say that so far the Israeli side has not blocked efforts to bring things in. The key issue is really global availability and mobilizing resources globally. As we know, you know, not just ICU beds, but ventilators and simple personal protective equipment is very difficult to get. And I think there's global fights and competition around this stuff. So for the moment, to be honest, the problem is not on the Israeli side. Our worry, of course, is if there was an outbreak, that they would shut the border. They have basically threatened that. And while that may be understandable in terms of trying to keep the virus out, that would be the worst thing that can happen, because I often compare the situation here to that of a cruise ship. We have seen if you cut a place off that badly needs to be supported, it makes things worse. And an outbreak here will have an impact on Israeli security and well-being. There's no doubt in that. So our plea is that the current absence of blocking materials getting in continues, that it's facilitated, and in fact, that if there were an outbreak, God forbid, that then the border doesn't get shut. We need the opposite. We need an open border to then cope with it, also in the interest of Israel.
So I have a question here from Courtney Peterson that is for both Gwyn and Matthias, and I'll throw it to you, Gwyn, first. Oh, I'm sorry, excuse me. The question is actually from Maureen Tobin. The question is, how much COVID testing is available in the West Bank and in Gaza? And are there likely to be far more cases than reported because of insufficient testing? So the question of testing for both of you, Gwyn.
So in the West Bank right now, there's about 5,000 people being tested a day. So the testing capacity has increased and is relatively good. Only people who have symptoms of COVID are being tested. So there's a lot of work still done on tracing, which is a really important component of the strategy that the Palestinian Authority has. Where we still have some concerns around testing, I mentioned briefly at the beginning, is in East Jerusalem, because the testing centers are only recently opened and we don't think that we're really capturing as many people as are needed. So there's some concern there that we may be underestimating the number of cases. But things are moving in the right direction. So we might be missing a couple of hundred of people, but we don't think it's in the thousands. So the situation is relatively under control. And maybe just to build a little bit on what Matthias was saying about ICU beds and ventilators, really the approach we've taken is we have to prevent the spread of the virus because we just don't have the health systems in place to mitigate or to address needs if there was a large-scale outbreak. So that prevention is really the only option, because we don't not only have the right number of ICU beds, we also don't have the number of staff that are trained in order to be able to manage them or the resources. So that's really been the approach I think we've both taken in terms of the response.
So the situation on tests in Gaza is we've had a total of 4,500. So to put that into perspective, Gwyn talked of daily 5,000 tests in the West Bank. In Gaza over the last 7 weeks, we've had in total less than what is happening in the West Bank on a daily basis. So capacities are very limited in those terms. Now, does that mean that we don't know what the full picture is? Yes, that's what it means. That's one of the reasons why I say complacency is the worst thing to happen now, because we just simply do not know if the virus has been transmitted into the local communities. Of course, the longer we don't have reports of cases, including people being seriously ill and or dying, and there has so far not been that, we can be reasonably sure that if there may be people who have an infection, but it's not taken on a serious form. I think after almost 2 months by now, through social media and other sources, we would know about it. But we can for sure not be sure that it is limited to the officially known cases.
Thank you. I would like to return to the issues of funding, given a couple of questions that we have in the Q&A. And let me just remind folks, we got some great questions here. Please do go to Q&A at the bottom of your screen if you have questions that you would like to ask of our great panelists. So this question comes from Sue Fischlewitz, and it is for Elizabeth. Could you repeat, Elizabeth, the total amount of support that the U.S. cut 3 years ago? And if I may, I'm going to actually add a couple of follow-up questions to that. Could you give us a sense, Elizabeth, of what appropriations have looked like more recently, what's actually happened with that money that's been appropriated? And could you talk to us a little bit about what kind of support you've been able to gather from Congress? I know there have been some important efforts lately in terms of congressional letters calling on the administration to release funding. I wonder if you could talk a little bit about that congressional support. I'm going to add one more question to the issue of funding, just as I throw out lots of questions all at once. We have a question from Shula Gilad that follows up, I think, on the issue of the international community filling in some of that lost funding. The question is specifically, what about Qatar?
Okay, sure. So on the very first question, the last year that the US was funding us, it provided about $360 million annually to our overall budget. That was about 30% of our total budget. The second question on appropriation. So UNRWA has historically enjoyed bipartisan support in Congress, and funding for the agency was provided on that basis through Republican, Democratic administrations from the inception of our agency in 1949 until the beginning of 2018, through an account that is responsible for providing funding to global refugee and migration crises. So that money continues to be appropriated in that account, and it is available to be provided to us any day, at any moment. So it is there. That indicates, in a way, ongoing bipartisan support for the agency. We believe there is an understanding in Congress that there is no alternative to UNRWA, and that until there is, which will have to come about only when there is an agreed, just, and lasting political solution, that we remain the only entity that can provide these services. As you said, there have been a number of public initiatives by various members of Congress over the past years calling on the Trump administration to restore funding. There was a recent example led by Representative Dingell, onto which 59 total members in the House signed. Previous to that, there was letters in the House and in the Senate. So our view is that because we are a humanitarian agency, humanitarian assistance under any circumstances should never be politicized. That is something that should be provided on the basis of need and need alone. Palestinians, like civilians everywhere in the world who need assistance, should be entitled to that by the world's largest humanitarian donor. And then the last point on Qatar, we've had uneven support from Qatar over the last several years. At the height of its support, it provided us $50 million in 2018, along with its other Gulf neighbors. So part of our strategy to overcome the US funding loss absolutely is to increase the amount of funding that we receive from the Gulf. And that's something that's been very uneven and unpredictable, which really contributes to our sort of growing financial uncertainty.
Great, thank you very much for that. I do want to share a comment in our Q&A with our panelists, because I think you should hear this. Joanne Riopel says, I just want to thank you to all of you for your wonderful work. We at J Street would like to echo that. We appreciate so much all that you do. Okay, so in additional questions for you all, we have a question from Abigail Metzger. I hope I didn't completely bludgeon that. I tried my best. The question is, what impact has addressing the COVID-19 crisis had on the delivery of other healthcare needs aside from fighting COVID-19, especially people needing to have medical care like for cancer and dialysis in Israel? And also, Abigail asks, what services does UNRWA provide to children and adults with autism and other special needs? So if I could ask Gwyn and Matthias to respond.
Thank you, and thanks for the question. Like everywhere, the health system is under pressure with the triage that we've put in place and the testing for COVID-19. So what we've done is reduce the primary healthcare services in our health clinics to only address emergency needs. And so what we've done to help people is provision of non-communicable diseases, that they have their medicine for longer periods. So rather than give 1 month prescription, we give it for 2 months to limit need to travel to health centers. We're very strict on appointments on vaccinations for children and make sure that people are separate when they're coming with their children for vaccination. So that type of thing. But it has had a strain on the health system, particularly for chronic care. Cancer and dialysis has been mentioned because all of those cases are referred to tertiary health hospitals, and the majority of those that are treating that complex cases are in East Jerusalem. And so those hospitals are also focusing on the COVID response. So we have seen a slowing down of patients accessing those services. We've also seen that patients have to stay overnight in the hospital, but their families can't come and visit them. So it has put some strain. In terms of how we're working with children with special needs, they're integrated into our education system. And it's very important that it's a key component of how we work with children, whether it's learning disability or learning needs. And so that's part and parcel of our services. If the special needs are more serious, then we work with local NGOs to reinforce our education support to them.
If I may just complement, so on the special needs, it's the same approach, of course, in terms of integration. On the health side, 3 quick comments. One is we've learned from the Ebola crisis that, in fact, we need to be very careful because in some countries hit by Ebola, more people were affected negatively by the measures put in place to fight Ebola than Ebola itself. You know, one has to be careful about these comparisons, but we definitely need to all the time keep a lookout on what's the right balance between addressing COVID-19 and everything else. Secondly, what we've done in our case, because again, we've been lucky in that there hasn't been a local outbreak, we, for example, stopped all dentistry and all accompaniment of pregnancies, and we are slowly but surely bringing that back because we're not having to deal with COVID-19. So essential dentistry is back in our health centers because, of course, if you leave that too long, that can become a serious problem. And we are accompanying at least the most urgent cases in terms of mothers that need support through pregnancies. And then the third comment is I had the privilege to visit one of our health centers in full gear, so I have a new appreciation for health workers all around the world. You know, I got tired after two hours of wearing a face mask and gloves, and these people do it for 8 hours. So I really think health workers all over the world are heroes. And so are ours. And while ours are not so much, again, fighting or dealing with Corona itself, they are ensuring that the most urgent cases get supported. So I heard countless stories of people taking, for example, non-communicable disease medicine, you know, to homes, to people, to elderly people who couldn't come to health centers, etc. So real heroes under very difficult circumstances to ensure that essential healthcare continues.
Great, thank you so much. All right, we still have a number of questions. I apologize to our audience because there's no way that we will get to them all, but I'm doing my best here, and it's just a testament to the importance of this subject and the amount of interest from our viewers. We have a question now from Glenn Rogers, and the question is about the relationship between UNRWA and the Jordanian government and what sort of relationships are happening there. And if I may ask to expand that a little bit and talk about the relationship that you are having, Matthias talked about it a little bit already, but with the Israeli government, right, in terms of fighting COVID-19. Obviously, this is something that is not contained within specific areas. So if we could talk a little bit about Jordan and Israel in your work.
Maybe just one point on Jordan. UNRWA has enjoyed a long-term partnership and positive relationship with the government. It has been among the governments who has worked and advocated very strongly on our behalf to raise funds for the agency. So for example, now for several years, the government of Jordan at the highest level has co-hosted together with Sweden a ministerial meeting aimed at fundraising for the agency. So at the highest level, I think we enjoy the strongest possible support. And from their perspective, they continue to say that, UNRWA is a matter of national security for them. So when we start to have financial difficulties, it has a direct impact on their own national security.
Maybe will I jump in on the Israeli relationship? I think what was notable, I think, in early March when there was the outbreak of COVID-19 was the intent and the willingness to work together and really address the virus, because there's obviously an understanding that it doesn't know borders and everyone will be affected, and there really needs to be close coordination. So there was efforts to support with protective gear, ensure that testing kits were made available, and facilitation of imports to the West Bank of whatever was needed. And I think some of that coordination is still there. There are, however, more significant issues, and I did touch on those before. One is this concern of the Palestinian workers moving back and forth through checkpoints and control of that. And there has been an agreement to coordinate better, and if workers are sick, that they're brought to the checkpoint, and this coordination with an ambulance or a health service to bring people to be tested. We had several incidents of workers just being dumped with suspected symptoms, and obviously that created a lot of problems. So that's one area. And then the other issue is really that there's certain things like demolition of buildings, for example, that are ongoing at the moment. A detention of people after search and arrest campaigns, and not the correct protocols are not being put in place. So putting the people who are being arrested at risk, as well as the soldiers. So there's certain components of the occupation that have been counter to helping us address the virus and to try and mitigate some of the spread. So that remains a concern, and that's something that we're continuing to advocate on with the Israeli authorities.
So we have two more questions left that I'd like to see if I could get you all to address in our remaining few minutes. So one of them touches on, we talked about UNHCR earlier. Joe Goldman asks, is there any coordination with UNHCR for getting resources for treatment and prevention of COVID-19, or is there any competition between those two UN agencies? And then I'd like to kind of end on this note. We have a question from Davidson, who asks, assuming the funds were provided from the current funding sources, why is it not viable for the PA in the West Bank and Hamas in Gaza to provide the services UNRWA is currently providing? I'd also note, of course, that UNRWA doesn't only operate in the occupied Palestinian territories, it also operates in Jordan, Lebanon, and Syria. Is it conceivable for those governments to provide, those host governments to provide the resources? So you have a few minutes. Please answer all of those questions very thoroughly. Go.
Should I start?
Yes.
On competition with UNHCR concerning COVID-19, no, I haven't seen any of that. I think the key UN aid, well, first of all, I really think the UN is coming together around this, at least in Palestine. And what we're hearing also from our colleagues in Lebanon, etc., the UN country teams are really doing their bit to ensure we are coordinated. There is clear roles and responsibilities, UNICEF doing its bit for everyone in terms of purchasing, WFP doing its bit for everyone on logistics, etc. So I really have not come across any unhealthy competition. I mean, each agency will always, of course, try to ensure that its good work is shown and that it gets its fair share of resources. But the incidents of unhealthy competition are really far and few in between, because I think everyone realizes we have a common unseen enemy here, and this is not the time to start competing and showing muscles. And, you know, it's, again, because it's a public health crisis, WHO is really in a driver's seat around what are the right things to do. UNHCR and UNRWA, in those terms, we are a delivery organization, so we play a role that way, but not in terms of leading and determining who should be doing what in that sense. Now, the interesting question on why can't, if the funding was there, why can't Hamas provide services in Gaza? It reminds me of an interesting conversation I once had with an ambassador whose country shall remain unnamed, who first criticized me for about 10 minutes for working with Hamas because it's a terrorist organization. And I was supposedly channeling funds to a terrorist organization. And then this individual asked me, well, but why can't Hamas do it? So I said, I mean, please, you know, explain that to me. That sounds weird, you know, because you know what Hamas is. And I sometimes say, you know, in Gaza, there is no other agency that can run 276 schools. It simply is not possible. Well, there is one agency, Hamas. Do you really want that? Do you want to replace an international agency, the United Nations, which teaches children international values, including human rights, with a movement, as they call themselves, that I don't think believes in those same values necessarily? So I think it's the wrong question, both from a capacity point of view. It's a wrong question from a values point of view. Is that what we want to expose Palestine refugees willingly to? And of course, it's also historically the wrong question, because the issue is not, you know, what host authorities can do, in this case Hamas. The issue is, what's the international community, including Israel, doing about finding a just solution that has to be about a state the Palestinians can call their own. It's not a technocratic discussion on who runs schools. It's a discussion on who is responsible for finding a just solution.
So I really apologize, because we've hit noon here on the East Coast of the United States. So we'll have to cut off the discussion. I think it's been extremely productive. We here at J Street feel privileged to be able to host all of you. Matthias, thank you so much for joining us from Gaza City. Gwyn, thank you for joining us from Jerusalem. And Elizabeth, you from here in DC. Obviously, there's more we could talk about, but this has been a really great discussion. So thank you so much to all of our viewers for joining us today. And this concludes this call. Thanks so much.
Thank you very much. Thanks for your interest.
Thank you.